Good afternoon, and thank you for joining us. I'm John Copps from Mutual Ventures, and you're very welcome today to today's conversation, where we're going to be hearing from colleagues from Greater Manchester on their experience of delivering support to people that are struggling in work or out of work due to health issues. This webinar is aimed at colleagues from across the country delivering programs to support people with health conditions. And our window into this world is the work of the DWP DHSE's WorkWell programme. So we'll be focusing on how that service is structured in Greater Manchester, in that regional geography, with all its local differences and needs, what examples of new approaches they're using, and what the experience is of people using this service. So this webinar is part of the WorkWell programme, which is funded by the DWP and DHSE, and we've chosen to focus on Manchester as its approach of giving autonomy to its different localities provides a range of perspectives and approaches under one umbrella. So welcome to all colleagues joining us from the programme and from outside the programme, and we'd love to hear from you during this discussion. So please do use the Q&A facility at the bottom of your screens to ask any questions you have. And we're recording this session and can make that available afterwards. So we'll be meeting colleagues from across Greater Manchester in a moment. First, we're going to we'll structure this webinar by taking a programme perspective, and then we have three stories, one about innovative referral pathways around integrating employment support and secondary care in Manchester, and the second about the impact of relational coaching approaches in Rochdale, and the third around success with Manchester's racially minoritised groups. And Manchester is a recent award-winning service from an award from the Employment Related Services Association. So congratulations to them for that. So let's start this session with Rachel, who's come on screen. Hello, Rachel. Thank you for joining us. Can you say who you are and just set the scene a little bit for Manchester and WorkWell?
Yeah. Hi, John, and hi, everybody. Good afternoon. I'm Rachel Nielsen. I'm a strategic lead within the population health team at NHS Greater Manchester, and I am the Learning and Change Manager for the WorkWell programme. So myself and colleagues from our Greater Manchester Combined Authority jointly submitted a bid to be part of the WorkWell Vanguard programme, so to be one of the 15 Vanguard sites. This was back in early 2024. So the opportunity to be Vanguard very much aligned with our kind of priorities with GM. We had a long established relationship of working together with our VCSE partners and different local authority colleagues in relation to addressing work and health. And the Vanguard opportunity for WorkWell gave us an opportunity to take this further and strengthen our approach. We initially set up a steering group back in the December of 2023. These things always seem to happen at Christmas. But that was really key to our design to ensure that the WorkWell model that we designed was appropriate for Greater Manchester and appropriate for our residents. And in doing that, I'm going to share a few slides now that just provide a little bit more detail on the approach that we took. So here we've got our 10 local authority areas in Greater Manchester. And our initial thinking for WorkWell was that we would have a one GM approach. But that very quickly, through that co-production of our initial steering group, we realised, listening to our localities and recognising the existing kind of provision that was already in place and the relationships we had in place across the different Greater Manchester local authority areas, and also the diverse needs that our population have in those different areas, we decided to move forward with 10 different WorkWell delivery models. So quite complex in scale and complex in size, but we felt that this would be the best to make WorkWell a success for Greater Manchester. In doing that, we established kind of a GM function. So I am one of a number of members of a GM WorkWell team. So myself and the team, we provide overall programme management support around quality assurance and ensuring that we comply with the grant agreements. we provide that consistency in governance and data and IG and all that fun stuff that comes with delivering a programme of this scale. But most importantly, we also support the kind of development of the workforce and creating a learning environment for WorkWell. But then the leadership of the 10 WorkWell services very much happens at place within our locality services. So 7 out of our 10 WorkWell services have chosen to use WorkWell as a single access point. So recognising that it can sometimes be a confusing landscape for residents and even professionals when looking for appropriate employment support. And those remaining areas, they've used kind of multiple access points, but kind of supporting a no wrong door approach. We have a number of our local authority areas who have primarily being led through council delivery, but often many of those have also then chosen to commission alternative providers to either work alongside them in the delivery of that service or to be delivering kind of independently in that space. And you'll see that actually the VCSE are kind of our primary delivery partners across our Greater Manchester WorkWell footprint, which has been really important to kind of that really reaching the communities, and you'll hear more about that in this session today. We have 2 areas. One, so Stockport primarily focused on a primary care provider, and then more recently Tameside as part of the Primary Care Innovation Fund that's also funded through the WorkWell Partnership are looking at a primary care delivery model. In Manchester, one of the 3 different approaches that Manchester took for their WorkWell delivery model was to have a very focused secondary care delivery, which is the model that John was just referring to then, and you'll hear more from our Manchester colleagues in relation to that today. And then Salford also took advantage of the opportunity that came with having a university within the city and working with the physiotherapy department within Salford. They've been able to provide rapid access to individuals presenting with MSK conditions in the area. So we are very similar to the other areas across the country where we're predominantly supporting people who are struggling with MSK conditions, mental health issues, and other issues around confidence and well-being. So these in no way reflect the kind of diverse and kind of more integrated partnerships we've got now, but these were just the initial delivery models that we supported our localities to take forward. We have over 60 work and health coaches delivering the work. They're very skilled and passionate workforce, but as our network itself, it's huge. We're scheduling our second network event, and we've got over 150 people coming along who are responsible for the kind of overall oversight and delivery of our WorkWell model. We launched in October 2024, which was the requirement of the WorkWell partnership. But in doing that, we only launched with 4 of our locality areas, kind of giving ourselves permission to take a staggered approach, recognising that these things really do take time. However, since launching in October, we've supported over 4,500 Greater Manchester residents. So they're residents who've been struggling either to stay in work due to their health conditions or return to work. And you can see from that graph there just the progress that we've made since that go live date. And I think that's one of our kind of real lessons, is that it does take time. It takes time for those relationships to embed and for those referral routes to be established. But we feel we're on a really strong trajectory to continue to grow and to support more Greater Manchester residents. Here's just a little bit of feedback. We do routinely capture feedback in lots of different ways, and you're going to hear a case study today. But from our kind of thematical analysis through the satisfaction surveys that we complete as part of the WorkWell grant requirements, you can see here kind of that word cloud, some of the kind of really important support that's being fed back from our participants. And we're being found to provide empathetic and offer practical support and build confidence. And I would say that's really one of the strengths of WorkWell. It's that very holistic, person-centered support that both the participants benefit from, but actually the workforce really feedback that they particularly enjoy being able to kind of provide and offer that service. So I'll stop sharing those slides.
Yeah, thank you, Rachel. I mean, it's very striking, I think, the first slide, the sort of patchwork across Greater Manchester, which I guess reflects local need. And then the second slide, it's that almost the 6 months before the graph starts to sort of accelerate. So tell us a little bit about that 6 months and what what challenges perhaps in getting those sort of 10 areas set up?
Yeah, so we were had various levels of maturity and development in this space. So for some areas, it was quite new, or they put really innovative work in place, which was taking longer to establish. Other areas were kind of chomping at the bit for something like WorkWell and really keen. They knew exactly what they wanted to do with that. So I think what I would say between October and the 1st of January, that's when we kind of staggered our 10 local authority areas going live. And all areas are kind of really succeeding now. So I think those who went later, that's not kind of caused a lag now. I think sometimes it does take that time to put that support in place and kind of put those foundations in place, and obviously different commissioning arrangements through NHS, local authorities, that they are complex and they do take time. And from an information governance perspective, that was incredibly complex, ensuring that we had everything in place to be delivering across all those different providers. So that all of that took time, but in that time we had regular, as well as the steering group, that we then set up weekly locality leads meetings, and they've continued not at a weekly level, but they've been really kind of key to the successful delivery of the programme. And we now also have a work and health coach forum where we bring that part of the workforce together to really kind of share their good practice and their experiences at delivering WorkWell.
Yes, that's fabulous, Rachel. What we'll do, we'll hear a bit more from you towards the end of the webinar. Let's bring in Dave now. Thank you, Rachel. So Dave's from Manchester, and we talked about the approach of integrating with secondary care and integrating employment support with secondary care. So Dave, perhaps you could introduce yourself a bit and just sort of outline the model a little bit.
Yeah, thank you. Thank you, John. So yeah, my name's Dave Berry. I'm a work and skills lead at Manchester City Council. And we started doing some work with Manchester Foundation Trust to run hospitals in Manchester and Trafford. Another partner called the Growth Company, who are an employment employment provider and a social enterprise. We started doing work because what we knew was that MSK was an important condition in related to people being out of work, and there was no employment related services in our hospitals or in musculoskeletal settings as such. So we wanted to develop an innovative program to put in place. So we started working together as an unfunded pilot to test some services and begin a partnership, begin a good design process with patients and frontline staff involved. And what that led to is in December 2024, we were able to turn a 6-month unfunded pilot into a full WorkWell service that's gone on, as John kindly mentioned at the start, to be award winning, and as you know, last week achieved its targets for the WorkWell contract as well. So 4 months ahead of when it should do. What we actually do is we put growth companies' employment workers into Manchester Foundation Trust settings, so hospitals and some community venues as well. They attend things like classes around knee rehabilitation and things like that. They're in clinics, and they also access our waiting lists. And we ask patients, MFT ask patients if they would like support, and then referrals are made through to the Grove Company, who then pick that up. There's also self-referral pathways, and our clinicians can refer in as well as seeing patients. Important just to mention here that we're over 2 local authority areas, which is quite unique. Manchester City Council is the lead commissioner, but Trafford Council also enable us to work in their particular areas so that we can provide access support over our Manchester Foundation Trust pathway. It's a flexible service, and the referrals are very much like person-centered. We don't tell clinicians who to refer or when to refer or how to refer or what referrals are right. We say if somebody's got an employment related need, refer them in, and then we do all the work in the background. We don't burden clinicians with too much eligibility criteria. We've given them that space. We've also done innovative things like community appointment days recently, where we've been picking up referrals from patients attending those. Most referrals are made to an online portal, a referral form by the clinicians, and then Growth Company pick them up from there. But we are looking at moving to the Manchester Foundation Trust's actual Hive system, which is their relationship management system.
And
So
Dave, how do you get the sort of engagement of clinicians? I know you said you make it easy for them, but
yeah,
it's that first bit, it's winning the hearts and minds and just it's seeing work as a health outcome, I
that's
guess.
it. That's a really big part of the innovation. When we were designing this, we knew we needed it to be a service which was going to be beneficial for residents. It wasn't about patients. It wasn't about numbers. It was about providing a good quality service which was equitable and accessible for Manchester Foundation Trust patients. So we brought all the MSK clinicians, occupational therapists, um, physiotherapists together, and we did some training about how to have good work conversations. We told them about what the service would look like. Many of them had already been part of the pilot and had been helping to design it, but that training session I really think put us on a good stead. But very importantly, we've paid for NHS staff to be project managers, so they make sure that the referrals come through and they make sure that Growth Company have been integrated well into the hospitals. Growth Company are also on honorary contracts, which is important because it means that they're part of the team. They've got Manchester Foundation Trust email addresses, and they're not just somebody who turns up on a Tuesday to a class. You know, they're a formal part of the team. But I think paying for NHS staff's time is very important because it's freed them up to be able to integrate the project well and embed it well. We've also made sure at the start that the service was equitable. So an important thing for us is health equity. We wanted it to be accessible for all residents, especially from a cultural competency point of view. So Grove Company have recruited work and health coaches from the communities that they're serving, and I'm delighted to say that our performance is higher in terms of accessibility for underserved communities and racially minoritized group communities than the average, which is exactly where we wanted to be. And recently we've used Trailblazer money, economic activity Trailblazer money, to expand into other departments such as cancer and respiratory, and that's really starting to take hold now. So we've moved beyond MSK into wider. We've also got training to make sure that we've got a neurodiverse aware service, an adverse childhood experience and trauma-informed service, and as I mentioned, culturally competent, which are all key things for us. And I'll just finish on performance, just so you can get a really good understanding of what we've achieved. We've had over 1,600 referrals since December 2024, and that's resulted in 600 starts, which, as I said, has beaten the target that we set the Growth Company and the Foundation Trust 4 months ahead. 58% of people on program have had a positive outcome, with 22% having a neutral outcome. So they may have stayed the same, which is a good result. 86% have improved their mental health. 87% have been empowered to manage a health condition, and 86% overall have had improved health. And we really importantly for us, we're evaluating in real time and making changes to the service as it's live running. But it's been absolutely excellent for us to set up a secondary care pathway in our hospitals. Manchester already had a primary care pathway, but this has allowed us to go to a new area. And I think we've demonstrated by the results that we've achieved so far, and the award, that it's what's exactly needed. And we're looking forward to seeing that model rolled out more nationally, working with DWP to help that happen.
Yeah, that sounds great. And we've got a question that's come in on how have you used lived experience to help inform that service and the approach?
Yeah, that so in the design phase, before we went live and when we were designing the pilot, we held consultations with patient and staff groups to make sure that the service wasn't parachuted in, pushed in, because we knew my experience of 15, 20 years in this sector is work and health integration can be difficult. You've got to make sure that the space, time, and it's well-designed service. And the reason why I picked up Manchester and Trafford specifically at the start was, if we'd have tried to just push a service in Manchester and exclude a Trafford residents, that would have been really poor in terms of equity of access for patients, and it would have, I think, discouraged some of our NHS colleagues to refer. So those types of things were really important. And as I say, in terms of things like cultural competency, it was about making sure that the service was accessible to all our residents, and listening to what their needs were. So whether that was things like translation services or where they wanted to be supported and how they wanted to be supported. Thank you.
Yeah, brilliant. Well, thank you, Dave. We'll come back to you at the end as well with some more questions, I'm sure. But thank you for that insight into what you do, Lauren. Of course, this service is all about the people in the end, and our second story here from Lauren is around relational approaches to employment and health support, and in Rochdale. Lauren, are you?
Hi,
Hello.
yes, sorry, I am here.
Perhaps you could introduce yourself and just say a bit about the service.
Of course. So hi everyone, and thanks for having me on the webinar. My name's Lauren Pemberton Holland, and I'm a work and health officer at Rochdale Borough Council, and I am the team lead for the WorkWell service. So much of my role is operational delivery and on the ground, leading our team of in-house WorkWell advisors. So our WorkWell delivery has very much been a follow-on and an add-on, really, to a service offer that was already pre-existing in Rochdale, which is, I know Rachel mentioned about some of the localities having a single access point, and the single access point for work and skills provision in Rochdale has existed for a number of years. So following on from that, that meant that relationships with health professionals pre-existed, relationships with referral partners pre-existed. So WorkWell was a really nice kind of natural next step to be able for us to provide that support in-house. So in Rochdale, we support any Rochdale Borough resident who needs support from age 18 to retirement age, and we do support people who are past retirement age and wanting support in terms of work and skills as well. So we have tried to make that single access point as simple and as easy as possible for both residents and the referrers. So what that looks like might be a health professional has met a patient who has been out of work for 10 years, and he's starting to want to work towards employment. That individual gets a one-to-one conversation where one of our members of staff, and this isn't necessarily WorkWell staff, it could be a member of the wider work and skills team, but it's that idea, as Rachel said, of no closed door. So we can kind of do a bit of a triage and do a holistic needs assessment to see is there a service within that work and skills landscape that would work best for them and give them one-to-one support if needed. Sometimes they just need a little bit of advice on maybe volunteering or work experience, and they'll get that from the initial conversation. But where ongoing support is needed, we then signpost and refer. So to have that WorkWell service in-house, there was a need for residents who were coming through that single access point, and a need for our health professional partners and colleagues who were saying, I've got this patient who's off sick and really nervous about returning to work. And although some of the services in the borough do provide a work retention service, it allowed us to be able to provide that really person-centered support and have that control over it. So in terms of talking about our WorkWell service today, I really just wanted to use one of our participant journeys or case studies to kind of explain how we use that person-centered coaching approach for those who are close to the job market, they're working, they may have never engaged with services before, which is what we're noticing a lot about the WorkWell cohort. And this gentleman who came through WorkWell came to us through a slightly unconventional pathway in that he'd come through a mental health huddle that I sit in on to help discuss referrals with mental health practitioners. But he'd come through as a referral and actually was not able to access the wider mental health huddle support because all that he was asking for was a statement of fitness for work. Because he'd been signed off as unfit for work, and he wanted to go back to work before his fit note ran out. He was desperate to go back to work. And he hadn't engaged with mental health services, so no mental health professional felt, or no mental health professional in that space felt that they could make that judgment. He also hadn't engaged with his GP that often, so his GP had said, the fit note has been issued for this amount of time for this reason. So when I had the initial conversation to talk about the WorkWell service, I had very limited information, so I didn't know what he did for work. I didn't know how long he'd been off. But I explained, part of that conversation was actually quite a challenging conversation to say, when we're not able just to issue you a fitness for work statement, but we would really like to get you some one-to-one support so that you are able to return to work and whatever that situation looks like, that we can provide the ongoing support. He was allocated an advisor and introductions took place. And at first he was quite hesitant to access ongoing support. So we decided to approach his employer to understand what their concerns were, if any, because they were really hesitant to have him back as well. We had a 3-way meeting with his advisor, his line manager and himself. And it emerged that he had a bit of a historical pattern of making promises to his line manager about seeking support and getting support, but then not taking that next step. So a separate conversation took place with his advisor, and they talked about the benefits of getting some wellbeing support, which we fund through one of our VCSFE partners, Rochdale Mind. So we have a one-to-one wellbeing support advisor, coach. And he agreed that those sessions would be beneficial for him. And he hadn't accessed any kind of mental health support before then. But it was like that the idea that it was a non-clinical wellbeing coach and that it was being done separately to kind of the NHS and his doctor, he was really open to. So he started engaging with that wellbeing support, and a return to work plan was agreed. And his employer was really happy because we were actually able to go into the workplace with him to kind of review, how his progress was going. They kind of said, as part of one of those first return to work meetings, we actually have been a bit concerned about his performance, but not really known how to tell him. So his coach was able to have that communication in a supportive way that didn't have that impact on his anxiety and mental health. And I'm pleased to say that this was a case study his support began almost 3 months ago. His support has now been closed and he was comfortably back to his full-time hours and performing. And that was following 6 weeks of in-work and on location appointments with his advisor. And
that's a really good story to hear. The striking thing about that for me is that there must be a relationship there a really good relationship between the service, the advisor and him. But it's also the amount of connections you've been able, so speaking to his employer, part of the mental health huddle, other conversations you've had. If there's a successful ingredient in all that, what is it?
I think the successful ingredient was about shaping the conversation and coaching that individual towards them seeing the end goal. When he'd had that initial conversation, he was very, and understandably, very kind of focused on, I want to be back at work. And we explained that that was our goal too. And we could support him with that, but it wasn't perhaps as simple as a journey that he had initially hoped, and we wanted to help him towards that goal. So I think once we'd had that discussion around services that he could access, and also knowing that, you know, everything was optional. It was optional for him if he wanted us to go into his workplace. It was optional for him if he wanted to access the wellbeing support, but then explaining to him what the benefit of that would be and what the end goal would be. It was, it helped. It was like he by the end of the support, it was he was aware of how those things could benefit him, and he did return to work, and that had been his goal. But you know, he had improved well-being. He and also, you know, from a sort of business standpoint, what could have been him joining a waiting list for further mental health support, he's not had to, because that intervention has taken place preventatively, and he's returned to work, and work was something that was really beneficial for him and his mental health.
Yeah, great story. And what about the question of, so in practice, you manage this service. How do you make the judgment in terms of how to allocate resource? Because how much support to provide, or when?
So
how do you do that?
Of course, and I think, you know, to be a truly person-centered service, although we have a rough timeline for how long WorkWell support lasts, kind of GM wide and locality wide, of the benchmark or the ideal is 8 weeks. That's when we send a survey out to see how satisfied they are with the service. We judge it from and operationally, this is done on a case-by-case basis. We actually do weekly caseload reviews, because the service is quite fast-moving as a support service. We'll judge that based off what that individual's need is. So, for example, for this gentleman, he did need quite intensive support to begin with, and that involved, you know, maybe 2 to 3 hours a week of advised time. But it enabled me as team lead to review that on a weekly basis with the advisor to kind of balance against the other caseload demands and other caseload needs. I think that's something that's important about that WorkWell cohort as well, is it really is a very varied bag of sort of intensive support needs and, you know, requirement for quite elongated face-to-face time, and individuals who need 2 phone conversations with information and follow-up emails and a signpost, and that's all that they need from the service, because it really is about what they need and want. So when that initial assessment takes place and that holistic needs assessment takes place, it's very important that that's agreed with the individual, and that the advisor is aware of just how much support they're going to need and how much time is going to need to be allocated.
Yeah, well, it's great to hear that, Lauren, and the human face to the service as well. I think that's the critical thing. We'll invite you back a bit later at the end with others, but thank you for the moment. And
of course, thank you.
Thank you. And we're about to be joined by Elaine and Sefton from Manchester. Hi, Elaine.
Hi, John.
So you could introduce yourself and say a bit about the service.
Yeah, sure. Hi, welcome. Hello, everybody. I'm Elaine Redford, and I'm a working skills specialist from Manchester Council. And I've been working on the Manchester WorkWell programme since its design and implementation, and now the ongoing delivery. And I'm going to hand over really quickly to Sefton, actually, to bring it more to life. But I just wanted to say that it was really important for us in Manchester to reach our diverse communities, and we know that in order to do that, we need to work with the organisations that are based in the hearts of the communities. And Sefton is here from one of those organisations, and he'll introduce himself in a second. But I would say that the relationship that we've built with our voluntary sector organisations has been absolutely crucial to the success of the WorkWell programme. It's really allowed us to support those organisations, for one thing, to help them to manage these contracts, but also it's enabled us to be able to have a culturally sensitive support provision that reaches the marginalised residents that we know Manchester does have a lot of. So I'm not going to go on any further with that, because I'm going to hand over to Sefton to share their story so far, but it really does bring to life how important it is to be able to meet the needs of our diverse communities. So I'll hand over to Sefton.
Thank you, Elaine. Hi, my name is Sefton Simpson. I'm the Director at African and Caribbean Mental Health Services. We're delivering the WorkWell in Manchester in partnership with Empower Consultants, and our focus is on Black and South Asian communities. Now, in Manchester, there are anything up to 200 different languages spoken, and that makes us one of the most linguistically diverse cities in the UK. And it's one of the observations I've made of this in working with the council, and that they have been culturally sensitive and shown cultural humility in the fact that they've designed this in a way that it's specifically tailored to meet those who are at the furthest point from employment support. And to highlight that, I'm going to ask John just to show a little clip for me, and then I'll speak back after the clip's finished.
Yeah, so this is a short video of 45 seconds.
Sunshine. Today is sunshine. Yes. So today is the beginning of the helping hands.
I'm very inspired for Sumaya, Nazia, and for you. You are very helpful women.
Thank you.
I am a help for all Muslim community.
Thanks, John. So the main participant in that was somebody called Nasira. And the reason why we're using her as an example is because she, like most South Asian women, has invested her life in her family and being dedicated and almost become invisible in doing so, because the mother and the spouse and they're the backbone of the family to make sure everything runs. And then when the kids grow up and leave, they've then got to find out who they are again. And so before we even connect them with employment services, we've got to address confidence issues, we've got to address identity issues, and some of them are almost socially phobic because they've not had that increased social contact out of their direct circles. So it's about helping them through all this. And so we've had to be really innovative. And what we did, we had to, if you saw in that clip, there was a big cohort, and that just makes them more comfortable together. So we worked in cohorts. We also made sure that we did it around venues that they were easy to get to. They carpooled and car shared because some of them weren't even used to going on public transport. We had to take it very slow. We even developed a program which they then delivered a community kitchen. That was then to expose them to the public slowly so that they could then get used to having some experience doing volunteering and working. Oh, it's just a beautiful opportunity, and I'm excited about the program, and I'm really passionate about delivering it, because we know that there are issues around structural and institutional racism, but before you even get there are individuals who have got barriers themselves, and so this gives us a chance to work with them in their cultural setting so that they can become confident, and then it increases their chance of securing employment once they've built up that confidence level, and it's all because of this program, John.
And so, Sefton, were there individual advisors as well, as well as your group work?
Yeah, absolutely. So each of them were assigned a work coach as well, and many of them spoke the languages, but they also encouraged them to develop their English, because it's not about keeping them where they are, it's about moving them on slowly and using that graded exposure to get them comfortable operating in society again.
Yeah, and What are you most proud of so far?
Surprisingly, I would have to say, historically, I've worked with statutory services before, and I've had a mixed bag of experiences doing so. But one of the greatest things, I have got a beautiful relationship with the council delivering this, and I think that's what makes it work really well, and it flows all the way down the channel. I think what we found, where you have problems at the top, that can go through the channels, and it can just introduce stress throughout the whole process. But this has been fantastic, and it's a delight to work on this program. And sorry, I cannot not highlight the transformation you see in people, John, when they get a job or they come out of their house for the first time and they get a certificate because they've passed something. It's just beautiful.
Yeah, and it's all those skills being used in the economy and in society, I think, as well. On Elaine, what about from your perspective? What of the racially minoritized communities of Manchester got from this program?
Yeah, I think what they've got is something that they feel is for them, the tailored support that isn't just maybe just general employment support, which, you know, for some people they would feel that it doesn't suit them because they don't recognize themselves in those services. So I think having that cultural sensitivity, people being able to be supported by someone who looks like them, who may have had a very similar background to them, makes an enormous difference. So I would say this particular part of our WorkWell program is one that we are extremely proud of.
Yeah, well, it's great to hear that all about it, and also to hear Nasira's story as well. So I think we'll invite everybody else to come back into the discussion now, if that's all right. Hello again, Rachel,
Right.
Lauren, and Dave as well. We've heard some really powerful stories there, I think, and which shows the sort of, I suppose, the diversity of communities across Manchester and just exactly what you're achieving. The idea of I guess a question to you first, Rachel, what are you most proud of in this so far?
I think this session's just really touched on that. So we talk a lot, don't we, about the numbers of people, but the idea that kind of thousands of people have had an experience that we've just kind of heard described by Sefton and Lauren. I think that's huge to think that this service is making that kind of difference on people's lives. And then I think that what sits behind that is that partnership work, that network that we've created, and all that kind of passionate workforce. So I think that's probably, you know, the two things that make me most proud.
And one of the things that stuck out from your presentation, and also what Lauren said, was the single front door. We've had a question in the chat around how the various WorkWell services work with Connect to Work, which, if people don't know, is the intense work-based program that's coming on supported employment program that's coming on stream at the moment. I don't know who's best to answer that question.
Dave?
Yeah, hi. Yeah, so in Greater Manchester, we have Connect to Work monies, but we've also got an integrated settlement, so we don't have a distinct Connect to Work service like other areas. But we've got services like the individualised placement, supporting primary care, IPSPC. So in Manchester's delivery, people who flow onto WorkWell and need longer term support can be referred onto those types of programs. So we've got lots of our residents, patients who have accessed what we term is really accessible, engaging services. They're supported in that initial 12-week period of WorkWell, and then they can move onto those wider services that money like Connected to Work money pays for.
And we've got another question on the sort of link between health and work, which is a WorkWell. Do you see a distinction between work coaches and work and health coaches?
I think before delivery we did. But during delivery, we found out that it's almost one and the same in terms of what people need. There are always issues that are related to health that people need to unpack that will allow them then to thrive in work or to move into work. And so many of our coaches, if they don't have the skills to help them with that, they source the support and build that into their offer.
Yeah, thanks, Efton. Lauren, would you agree with that? Is that what in Rochdale? What are you called?
Yeah, of course. We've all got different titles, and we have a little joke about this every time we have a WorkWell networking event or something, because we do all have different job titles. Our work and health coaches in Rochdale are work and skills advisors because they are part of the work and skills team. But they are so we have recruited and looked at more of the side of work and skills coaches, but it is about kind of empowering individuals to help them on their employment journey and their work journey, so that they can access health information, so that they can access information on reasonable adjustments, or that they can approach their employer on reasonable adjustments that they might need. So it is very much about that health related work journey or work related health journey. So it does kind of cross both. It goes hand in hand. So although a lot of our advisors do come from a work and skills background, and that's the kind of world that we live in, it's very much about making sure those two journeys can go kind of complementary and
it's the holistic view.
Yeah.
Dave, did you have your hand up?
Yeah, I was just going to say, I think in the longer term, what we'd like to do is present a case to Department for Work and Pensions that services that are neurodiverse, aware, first aid, mental health trained, adverse childhood experience and trauma informed and culturally competent. That should be like the norm for our public services. So JCP work coaches in the future, we feel that over time, as part of Get Britain Working, we should be moving to more relational based services that ask a person, in the very first instance, what do you need to support you on your journey, and giving them that space to be able to achieve that, rather than the way the current benefit system works, which, as DWP acknowledged in the Get Britain Working white paper, can make some people feel abandoned in the system. So I think that's very much a model that all the Greater Manchester partners are trying to work towards and try and provide that learning, because at the end of the day, WorkWell and the Trailblaze, which we're also delivering, are about getting that learning message back.
Yeah, and so just let's pick in a bit more into that integrating health and work, which is part of the purpose of and you've explained the great success in secondary care, but across the wider system, and I'm thinking primary care as well, what are the barriers still left to overcome? What have you overcome, and what's still there to work at?
Yeah, so I think the first thing that's key is making sure that health staff feel confident in having a conversation about work, and taking away, the fear that can arise from that, making sure they're well trained in that conversation. Many of the clinicians that we work with, they absolutely believe that it helps people to manage their recovery, and that work's an important part of that. Good work is good for health. But whether it was always their responsibility to do that, I think that's the gap that we've managed to fill here. But also making sure there's a very easy, simple way to refer to get that support. So we're not expecting an occupational therapist, a clinician, to be able to support somebody back into work. But in conjunction with our growth company colleagues, we do want to see that happen. And as I said, I think for NHS services to really truly integrate, we've got to make sure that that we pay for their time and give them capacity to do that, and we don't just add to their day job. Because if they've got 100 tasks in a day, we know that the employment bit's going to be 100, because they're medically focused. So it's important to make sure that we carve out the right amount of time for them.
Yeah, and I don't know, Rachel, if you've got any thoughts on the integration question with health.
Yeah, I think go to primary care, I think going back to that kind of that premise that it really does take time and consistency. And I think we're really seeing across all our local authority areas some real breakthroughs with our kind of health colleagues. the reputation of WorkWell, those relationships that have developed. So across the board, we have primary care colleagues who now have WorkWell on their fit note system. So when somebody's being issued with a WorkWell note, the fit note, sorry, you'll get a pop-up about the WorkWell, so that prompts them to have a conversation there and then. But also when somebody's on a fit note, they're getting an automatic text message through I think it's the EMIS system we mostly use here in GM, letting them know about the WorkWell service, more co-location of kind of the work and health coaches or similar roles kind of within those primary care settings. So it's a bit of a ripple effect, I think. We always know there's maybe some more primary care colleagues that are more open and more on board with this integration than others, but it does start to build up, and I think people start to look and see what's happening in other spaces. So I think we're making some really big kind of breakthroughs in that space, really encouraging.
Yeah, grand. And I think Elaine or Sefton, what are the specific issues you found there around engaging racially minoritized groups? I mean, I guess it depends, but what are the particular things that you have to think about in terms of the integration with health?
I think one of the things, Dave mentioned the fact that we start at a position asking what they need in order to move them to a point of thriving in work or finding employment, but we have to be ready to support what we find. What we found is when we're doing that, there are some issues that people have that are deep rooted, and we've had to refer quite a few of our participants to our counselling service because there's some historic issues with bullying at work and bad experiences and racism that have really left people traumatized, and until that's supported, they will never thrive in work. And so it's about, once this model is scaled up, or we have to put resources in there to meet that demand, because there are some people who are hurting out there, and that's probably what I found most.
Mm-hmm. That's really insightful. We got a last question in the chat around a general question: do the projects have evaluation, and if so, is there anything that the audience can look at or that can be shared? No, Rachel, are you best placed to answer that? What's the plan?
We don't have a GM WorkWell evaluation as it is now, so we feed into the national evaluation of WorkWell, but it's not something that was done at a GM level, largely because there wasn't kind of, in that initial grant funding, there wasn't money in the pot for that. But I know at a locality level, there are evaluations taking place. Dave's popped his hand up there. I'm sure there'll be lots of individual learning from the different locality levels. And we're doing some work ourselves, I guess, as a team, as a network, looking at process as much as anything else, outcomes. So there's definitely some outputs from that we can share with people about kind of expanding on what we talked about today about how we went about the process here in GM.
Yeah, great. Dave?
Yeah, we've got we identified we carved out a small local budget, and we've used that for local evaluation, and we'll be publishing I think it's in medical journals in the new year, our approach. So once we've got that, we can share it through these networks for everybody to see.
Brilliant. Before we finish up, I'm just going to go around to the panel and ask you maybe one sentence or one or two words or a single word, if you want to, that summarizes what you think, what you'd like the audience to take away from this, from what you've learned and what you're doing in Greater Manchester. Perhaps I could start with Lauren.
I think put the resident at the front. What we say, residents, put the participant at the front of those decisions.
Yeah. Elaine?
I would say to persevere with the relationships between health and work, and when you find that person who's the champion, then just work as closely as you can with them, because it does lead to success.
Perseverance. We all need a bit of that, I think. Dave?
Yeah, we need to bin hard to reach and just understand that we've failed to reach in the past because we've designed poorly. If you design around people, you get better results. It's important.
Rachel?
I would say just keep creating spaces to come together and to learn and to develop those, relationships. Don't just do it up front, that co-design, build that in all the way. You will fail in lots of areas, but just create that kind of supportive learning environment.
Perfect. And Sefton?
I think I'd just say, yeah, just be mindful of every interaction you have in life, whether it's the bus driver, the person who you on reception you come in, everybody has a story and is going through something. So be the good part of the story.
Thank you so much for our panel, and I hope to everyone this has been a session that's given you insight, challenged you, or just given you something to think about. And there's lots we can do. I've taken a lot from this around person-centered, holistic, just perseverance. And I think there's great success in Manchester. Greater Manchester moving to the integrated settlement next year, and that's going to be the next challenge, I guess. But this is a great start and a strong point to build from. So this has been part of the WorkWell program, this webinar. So our advice experience is here to make use of. So please do drop me a line, and very welcome, pleased to have conversations with people. I'll circulate a copy of the webinar afterwards, and you can share that with colleagues. Please watch this space as well for more webinars on work, health and skills. Finally, just say a really big thank you to all our panelists, Dave, Rachel, Sefton, Elaine, Lauren, and thank you to you for joining us as well, and see you very soon.